welcome the tremendous progress that has been made, both on vaccination and on driving infection rates down. It is a testament to the NHS and everybody involved in the vaccination programme, and a testament to everybody who is playing their part in this lockdown. But we also know that the virus can quickly rebound. We know that mutations could evade vaccination. We know we're in a race against evolution. So we have a long way to go, because nowhere, to be frank, is COVID safe until everywhere is COVID safe. And none of us want to yo-yo in and out of lockdowns. So can he guarantee that the lockdown easing will absolutely be based on data, not dates, as promised, and that the assessment time between each step isn't compromised? Now, I welcome the extra surge testing, but what is the current time frame for genetic sequencing? How can it be speeded up? Now, overall trends are coming down, that is welcome, but infections in some areas remain stubbornly high. The national average is 100 cases per 100,000. In Leicester, my city, it's one of the highest in the country though. Infection rate is 222 per 100,000. In Ashfield, the infection rate is 246 per 100,000. In Hyndburn, infection rates have increased to 162 per 100,000. In Oby and Wigston, it's gone up. In Watford, it's gone up. In Worthing, it's gone up. So what steps will be taken to ensure that areas like Ashfield, Leicester, Watford, Worthing, Hyndburn, etc. aren't left behind when the national lockdown restrictions begin to lift? Or will they remain in localised lockdowns? Will the local authorities be given extra resources to do more door-to-door testing and retrospective tracing? And will workplaces in those areas be inspected by the Health and Safety Executive to ensure they are COVID secure? And of course, will people finally be given decent sick pay and isolation support? Now, many areas like Leicester are also facing a double whammy of relatively high infection rates and relatively low vaccination rates. So what further action will now be taken to drive up vaccination rates amongst hesitant communities? Will he fund faith groups, community groups, local public health teams to develop more targeted, tailored local vaccination campaigns? Which comes to tomorrow's budget. So tomorrow's budget can't be about the Chancellor's Instagram account. It has to be about the NHS and social care accounts. So can he guarantee that tomorrow we'll get an increase in the public health allocations to help public health teams plan their local COVID response over the next year? Will our NHS heroes get the pay rise they deserve? And with 224,000 patients waiting over 12 months for treatment, will our NHS get the resources it needs to deliver the patient care that patients and our constituents deserve?
Thank you very much, Mr. Speaker. Well, he's quite right to thank all those who are responsible for the vaccine rollout. It has been an absolutely remarkable effort, and he's right to say that the NHS have played their part, and they have played a central part. But it has been more than the NHS. It has also been the brilliance of the logistics, in particular of our armed services. It's been the volunteers who've come forward in their droves. It's been the regulator and the partnership with private industry. And I think this model of a combination of academic excellence and partnership between government, regulator and private industry is a model on which we can build. I know it's a model that they don't like much on the other side of this House. He says to me he likes it. We always knew that he's misplaced over there. His problem is that sometimes his rhetoric is aimed more at his backbenches than what he thinks is right up here. But I just urge him to listen to his own conscience, and to back us and back the businesses who are making this vaccination rollout happen, and to put that support into practice. He asked about sequencing, again done by a brilliant combination of academics, government and private businesses. We're now sequencing a third of the positive tests in this country, and that means that although that isn't yet a full survey of all the positives, although we're working towards that, it does mean that we are able to spot these variants much more than anywhere else in the world. We currently provide around 40% of the total global sequences of this disease, of this virus. That is and we're driving up that sequencing capacity. He asked about increasing the uptake of vaccination. He's quite right to, and we are working with faith groups and local directors of public health and others. Councils have got a very important role to play alongside pharmacists and of course GPs in increasing the vaccination uptake. But the vaccination uptake has been very, very high, higher than I expected, and I'm really thrilled about that. He asked finally about making sure that the roadmap follows data, not dates. We have rigorously set out the gap between the steps to ensure that we can see the effect of one step before we take the other. That is with the goal of having this roadmap as a one-way route out of restrictions so that we can all get back to the freedom that we crave.
We now go to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. And can I congratulate the Health Secretary on the brilliant progress of the vaccine rollout, which is a personal achievement for him as well as a collective achievement for the government. And also thank him for the transparency in that programme and indeed transparency on the risks of the new Brazilian virus. I'd like to ask him about transparency in another area, which is the new integrated care systems he's planning in his white paper. And the concerns expressed by the Nuffield Trust, the King's Fund, the Health Foundation, NHS providers at this morning's Health Select Committee about the lack of detail on just how the public will know how well their local ICS is doing. Sir Robert Francis told the committee that he favoured asking the CQC to Ofsted rate the new ICSs. And I just wonder whether he thinks that might be a solution to this accountability issue.
Thank you very much, Madam Deputy Speaker. And transparency has played a vital role in our approach to responding to this virus. And I think that is an important lesson from it that should be heeded globally. I think that in terms of the future of the NHS arranged around the ICSs, that transparency will be important too. There will be a crucial role for the CQC, which currently rates hospitals according to as he puts it, an Ofsted-style rating. And I think that it is vital that the CQC has a similar role when it comes to ICSs. And I look forward to working with him and other members of his Select Committee to make sure we get the details of that right.
Now I have video link to the SNP spokesperson, Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. While the number of cases with the Brazilian variant is thankfully small, it's a warning that being tested in advance doesn't rule out being a traveller who's carrying COVID. The South African variant is resistant to antibodies from previous COVID patients, and there's concern that both may be resistant to vaccine-induced immunity. They could therefore undermine the success of the vaccination programme. The Brazilian variant has already been identified outside South America, and the South African strain is present in 35 countries that aren't on the red list. The arrival of this Brazilian strain via both Switzerland and Paris demonstrates the various routes to the UK from high-risk countries and how a traveller could avoid the current hotel quarantine system by separating out the legs of their journey. Those infected spent several hours in close quarters with other travellers who even now would not be subject to hotel quarantine. I assume the government is tracing the passengers from these flights, but with genomics taking some time, there is a significant window for concerning variants to get a foothold in the UK before they're discovered. This situation wouldn't have arisen with comprehensive hotel quarantine as advised by SAGE. So why did the Secretary of State agree to such an inadequate system? And can he tell us the view of the Joint Biosecurity Committee? Does he recognise that quarantining just 1% of international arrivals does not protect the UK from these variants, nor those which may evolve in the future in other parts of the world? So will the government now review their hotel quarantine policy and make it fit for purpose?
Madam Deputy Speaker, the Honourable Lady is completely wrong and she knows it. There is a quarantine in place for 100% of arrivals as passengers in this country. And in fact, this episode, in which all those we've successfully contacted, all 5, have fully isolated and quarantined at home as required, demonstrates that policy working. Now, we have further strengthened it and introduced hotel quarantine, and that will no doubt give further reassurance. But the characterisation that she gives out is wrong, and some of the description of the organisations involved is wrong as well. I'm very happy to ensure she gets a private briefing so that she can understand the situation in future.
Now I have a video link to Pauline Latham.
Thank you, Madam Deputy Speaker. Could I congratulate my right honourable friend for the rollout of the vaccine and for the use of the sure screen tests, which are brought local to me. The pressure on the NHS due to coronavirus has caused the cancellation of thousands of elective operations. Can my right honourable friend inform me what plans he has to ensure that hospitals catch up on cancer diagnosis and care and cardiothoracic diagnosis and surgeries, and how fast he expects to progress this?
Thank you very much. My honourable friend makes 2 critical points. The first is that the manufacture and the purchasing of British-made tests is an incredibly important project. And I want to thank SureScreen in her constituency, who have worked very closely with us over a number of months to get a product that we can all be very, very proud of, made in Britain, to test people in Britain to help break the chains of transmission and control this virus. And I'm very grateful for her personal work in that regard. I also agree on the importance of the second point that she makes. In the spending review, £1 billion was put aside for the recovery of elective operations, as well as £500 million for recovery of mental health services. And this is absolutely crucial in cancer and all of the different elective areas, including cardiothoracic, as she set out. We'll be publishing further details of this recovery programme soon. At the moment, the NHS is just exiting a stage of very, very significant pressure. There are still over 10,000 people in hospitals with COVID, so there's still significant pressure, and we need to make sure that the staff and the team get some R&R, but then the next year will be all about that recovery that she talks about. The money's been allocated, and then we need to get on with it.
We now go to the Chair of the Home Affairs Select Committee, Yvette Cooper.
Thank you, Madam Deputy Speaker. The Brazil variant cases arrived a month after I raised this issue with the Prime Minister, and they show the problems from delays, but also the limitations of the pre-travel tests that didn't catch these cases. Even now, 99% of the 15,000 daily arrivals are not covered by hotel quarantine, and most people can still travel home from the airport by tube, train, or even plane, mixing with others, as some of these travellers did, without being tested on arrival in the UK. So why is the government still refusing to introduce additional tests on arrival and still allowing international passengers to travel onwards on UK public transport? Does he not recognise that these gaps in the system will let more new variant cases spread?
These cases would be caught by the new hotel quarantine policy. When she talks about the need for more testing, we've introduced tests on day 2 and day 8 to make sure that we can keep everybody who arrives as a passenger into the UK under the necessary level of surveillance.
Video link to Bob Blackman.
Thank you very much, Madam Deputy Speaker. My right honourable friend will be well aware that my constituency is an extremely diverse constituency in terms of its racial and religious makeup. And also our National Health Service staff have done a brilliant job on keeping up the fantastic vaccination rate during this period. However, we are still having to combat the anti-vax type propaganda that's going out. So what action is my right honourable friend going to take to ensure that people get the truth about the wisdom of taking the vaccine, regardless of what race, religion or of cultural background you come from?
Madam Deputy Speaker, it's an incredibly important question, and I pay tribute to the work that my honourable friend has done in getting this message out there. And in Harrow, we're vaccinating in mosques, we're vaccinating in temples, we're vaccinating in GP surgeries, and it is a critical part of the rollout to ensure the message gets to everybody that this vaccine is safe and it works. And it's no good just me saying that, but we want to and we are engaging leaders of all communities, faith leaders, of people who have strong voices in their communities, and critically ensuring that people feel as much as possible that the vaccination effort is accessible to them. It is on us to make sure that the vaccines are easy to get hold of and that people get answers to any reasonable questions that they may have. And I look forward to working with him further on delivering this across Harrow and the whole of the country.
Video link to Munira Wilson.
Thank you very much, Madam Deputy Speaker. I'm sure the Secretary of State will agree with me that every hour is vital in tracking down new positive cases, particularly new cases of new variants. So could the Secretary of State explain why it is that the eye-watering £22 billion that has been spent on the test and trace system, that it doesn't track each and every test that is sent out based on the unique code on every test? Surely this would help close in the net on positive tests much quicker than the public calls for help we've seen over the last few days, when that vital information is missing when each test is returned.
Madam Deputy Speaker, I'm not sure you were in the chair when I addressed this precise question in my statement. This not having the contact details happens in about 0.1% of tests. In this case, we think that the test was done as part of a home test kit, where obviously it is incumbent on the individual to set out those details, because home test kit can be both sent to your home, in which case of course we have the details of where it was sent, or in response to surges they can be taken round by the local authority teams and dropped off. And therefore we need to find out exactly where this one was dropped off. But as what she omitted to say is that the team have done a very, very good job of narrowing down to 379 households where this may be. The call out at the weekend has been answered with a number of leads, and we're working hard to make sure that we can find the individual concerned.
Video link to Aaron Bell.
Thank you, Madam Deputy Speaker. And could I welcome my right honourable friend's statement, both the scientific news and the progress of our vaccine rollout that suggests we're well on the way to getting back to normal. In particular, I was delighted to learn about the fantastic new data showing both the Oxford and Pfizer vaccines are effective in hugely reducing hospitalisations and deaths from COVID. And indeed that the Oxford jab, which is being manufactured here in Newcastle-under-Lyme, may even be the more effective of the two. So will my right honourable friend join me in welcoming that our European neighbours, like France, have recognised this fact and are moving to now allow this terrific vaccine to protect the lives of older people there, just as it has done in the UK?
Secretary of State.
Yes, Madam Deputy Speaker. I'm delighted to see any country recognise the life-saving value of the Oxford AstraZeneca vaccine, as we recognise the life-saving value of all that have passed assessment by our regulator, the MHRA. And this vaccine, we know, is not only safe, but it is saving lives and stopping hospitalisations right across this country right now. And I pay tribute to the scientists behind it who have done so much work to get it to this place. And it is simply fantastic to see in the data with the naked eye that these vaccines are saving lives.
Video link, Ian Paisley.
Thank you, Madam Deputy Speaker. And can I also congratulate the Secretary of State for having the temerity and the leadership to identify early on that the vaccination and getting a good vaccine was the way ahead. And here we are very much leading the way for not only Europe, but indeed for the world. And indeed, a few weeks ago, the Irish government themselves and Europe tried to actually steal vaccines out of the arms of people in Northern Ireland because they were so jealous of how good the United Kingdom was doing. With that in mind, can the Secretary of State let us know what he's going to do whenever, by probably late summer, we've got 8 times the amount of vaccines the United Kingdom will actually need? Is there a list being compiled of those needy countries where the United Kingdom can help and assist those people in those countries with vaccination?
Secretary of State.
Yes, absolutely. Madam Deputy Speaker, whilst I am so proud of the work that we've done in this UK, in this United Kingdom, to both develop the Oxford AstraZeneca vaccine and also to buy vaccines from around the world that are safe and effective and be able to vaccinate everybody here at home, I'm also absolutely cognizant of the fact that vaccination around the world will be necessary. I was very pleased to see that COVAX has started vaccinated in Ghana last week. And while we do currently look as if we may have excess vaccines in the future, we have clearly committed that we will make them available around the world. Now, we know for sure that we seek to vaccinate with 2 doses every adult in the UK. There may well be a need for a 3rd vaccination over the autumn against variants, and there is currently a clinical trial considering the vaccination of under 18s. So the exact number of vaccines that we will need for the UK population is not yet known, but we are absolutely keen to ensure that we then go on to support with vaccines, as well as with money that we have already pledged, support the vaccination of the most underdeveloped parts of the world.
Video link to Mark Pawsey.
Thank you, Madam Deputy Speaker. The Secretary of State knows how well the vaccination programme's going here in Warwickshire, and may I tell him that his remarks in Friday's national briefing were greatly appreciated here. Many of the residents being vaccinated at Lockhouse in Rugby have asked me about the road back to normality, and some about getting some sun on a foreign holiday. So I wonder if he could say something about any plans the government may be considering for people wishing to travel both home and abroad to be able to demonstrate that they've received their vaccination through some form of certification.
Secretary of State.
Well, Coventry and Warwickshire have done an amazing job, and I was very, very pleased to see them top the ranks that were published on Thursday of the areas of England that have vaccinated the most. And so my congratulations to him and his team. The answer on foreign holidays is that we said in the roadmap that international holidays will not be allowed before the 17th of May. And we're working with the Global Travel Task Force, which in fact met this lunchtime, just before I came to the House. It's chaired by my right honourable friend, the Transport Secretary. I'm on it along with Home Office and Foreign Office colleagues, and the travel industry, the airlines, cruise ships and others from across the travel industry. That will report by the 12th of April. Now, the challenge is that whilst last year international travel restrictions were about restricting the number of cases due to high prevalence elsewhere when the prevalence here was low, we also now have to take into consideration the risks from variants of concern, and therefore more understanding about the impact of vaccines on variants of concern, like the variant first discovered in Manaus in Brazil that we were talking about earlier. More information about that is critical to answering the question of when we'll be able safely to reopen international travel.
Video link to Florence Eshalomi.
Thank you, Madam Deputy Speaker. I received some welcome news this morning that Lambeth's local COVID vaccination team is one of the highest performing teams in the country. Our local CCG reports that 85% of people over 75 have now been vaccinated and 89% of residents in care homes. And here in Vauxhall, we've had to implement the surge testing operation in the past few days because of the case of the South African variant that was discovered locally. This is all down to the tireless efforts of our primary care workers, our nurses, GPs, pharmacies, along with an army of volunteers. But I'm concerned that despite this heroic effort, there is still some misinformation and vaccine hesitancy. Does the Secretary of State agree with me that more needs to be done to counter this misinformation and support vaccine roll-up and take-up amongst our BME communities?
Secretary of State.
Yes, I do, Madam Deputy Speaker, and I want to add one to the long list of people who the Honourable Lady rightly thanked in Lambeth for the incredible work of getting take-up as high as 85% amongst the over 75s, and that's her. She has played a personal leadership role, and I thank her for that and pay tribute to it. There is still a lot of work still to do, and I hope that we can keep working together on it.
Video link to Jane Stevenson.
Thank you, Madam Deputy Speaker. The pace and scale of the vaccination programme has been incredible, and we owe a debt of thanks to everyone involved. In Wolverhampton, we've kept pace by using a variety of locations, including our leisure and community centres. As we all look forward to restrictions ending, I hope these public buildings will be returned for leisure and community use. For how long does the Secretary of State predict we will need a mass vaccination programme, and with the potential need for a rolling programme of booster injections or vaccinations against new variants, what infrastructure is being planned so we can protect our entire population for as long as is necessary without overburdening our NHS?
Secretary of State.
My honourable friend raises a very important point. Free the leisure centres. They are being used, many of them are being used as vaccination centres now, but I like her, look forward to the day when they can be used for the purpose they were built, as leisure centres. And so it is important that should we need a continued vaccination programme, for instance, over the summer and into the autumn, as seems likely, that we will have to move to more permanent places or places that are free to be used as vaccination centres over that period. In fact, that has already started to happen. We've already started to move some of our both testing and vaccination centres to more semi-permanent sites to free up the original sites that we often started with because we needed things to move incredibly quickly. So that is an important consideration. It is frankly best done as close to the local area as possible. So it's best that I don't get involved in each individual one. I'm absolutely certain that the NHS in Wolverhampton is far better placed to make these sorts of decisions than I am from this dispatch box, Madam Deputy Speaker. But I hope that they'd keep my honourable friend informed.
Video link to Daniel Zeitner.
Thank you, Madam Deputy Speaker. I'm afraid data, not dates, clearly hasn't worked because people have quite understandably just focused on the dates. And the spring sunshine at the weekend meant that in lovely places like Cambridge, it was very, very busy. So is the government now going to make a precautionary adjustment, or with hospital numbers still so high, take a chance and risk running the NHS into the ground?
Secretary of State.
No.
Dr. Julian Lewis.
Given that we believe in people taking responsibility for their own actions, will my right honourable friend confirm that the refusal of a minority to accept vaccination is no reason to delay the lifting of restrictions on society as a whole?
Secretary of State.
I think this is an important point. We do not have mandatory vaccinations in this country. We do encourage as much uptake as possible, but with uptake levels well into the 90s amongst those groups who've been offered, it is clear that we will be able to get very, very high levels of coverage and therefore lift restrictions, and I hope that we'll be able to lift restrictions on the basis of the dates in the timetable set out. But as per my answer earlier, we will also monitor the data of the impact in between each one.
Video link, Mohammed Yassin.
Thank you very much, Madam Deputy Speaker. Anita Barker, the head teacher of Scott Primary in Bedford, is doing all she can to keep our schools safe and open. But she knows more can be done and wants our staff to be vaccinated. I understand the JCVI's reasoning on priority, but we have already made a special case for our schools. The whole success of the roadmap hinges on schools going back safely. So does the Secretary of State have political will to do all he can to prevent further school closures? And does he recognize that means vaccinating school staff as soon as possible?
Deputy Speaker, I'm very, very happy to ensure that as much as possible, school staff are vaccinated whenever they possibly can be within the JCVI categorisations. But we do have to follow the clinical advice on this because there is no evidence of teachers being worse affected by COVID than other professions. And I think it's incumbent on us all to ensure that the message gets across that this order, this prioritisation, the order of the queue, so to speak, is based on the best clinical advice as to how to save most lives most quickly. And I'm sure that's something in which everybody wants to share.
Chris Grayling.
Thank you, Madam Deputy Speaker. Can I again congratulate my right honourable friend on the 20 million milestone? It is a fantastic achievement for everybody involved. But could I probe him on the question of outdoor transmission? It's been quite clear in the last few days that the level of adherence to the rules has dropped in outdoor settings. Has his research shown that there is genuinely an issue around the transmission of the virus outdoors? And have we actually seen any significant incidents of widespread transmission in outdoor settings?
The clinical advice on this is that outdoors is safer than indoors, that the likelihood of transmission outdoors is much lower, but particularly in crowded outdoor areas, it is not nil. And so hence the roadmap is based on opening up outdoors sooner, but people should still follow social distancing and of course should follow the rules. But it does mean that come the 29th of this month, we are able to make that step in terms of opening up outdoors first.
Video link Martin Day.
Thank you, Madam Deputy Speaker. The Scottish Health Protection teams are having to trace all the people who travelled on the plane to Aberdeen. And there must be similar risks and concerns in England given the travel through London. Of course, there are no passenger lists for anyone who had onbound travel by train. So does the Minister not agree, therefore, with me that it's a matter of urgency that his government changes policy to reduce the risk of importing further and more dangerous variants?
Secretary of State.
Well, of course, since these the six under discussion with the variant of concern first found in Brazil travelled here, since they travelled here, we have introduced further strengthening at the border, the hotel quarantine, and I think the best approach here would be a UK-wide one. I discussed that with my colleagues in the devolved administrations, and I think it would be. I look forward to a time when we're able to have an aligned policy.
Andrew Jones.
Thank you, Madam Deputy Speaker. The constituency data released by Public Health England last Friday showed that over 30,000 people in Harrogate and Esborough had had their first dose of the vaccine. Now, this is fantastic local performance, alongside the stunning national performance, reflects the expertise, determination and teamwork of many people, and I'd like to put on record my gratitude to them. Can my right honourable friend confirm that we're on track to give everyone their second dose of the vaccine within 12 weeks of the first?
Secretary of State.
Yes, we have the vaccines available, and local areas need to know that the vaccines will be delivered to them in order for them to meet their scheduled commitments for those second jabs. The logistics of the second jab is actually slightly more complicated than the first jab because you need to make sure that the right person gets the right vaccine at the right date. And so there's a huge amount of work underway as that programme starts, today being 12 weeks to the day since the vaccination programme as a whole started. So that work is underway. But can I just put on the record, Madam Deputy Speaker, my thanks to the team in Harrogate who've done an amazing job vaccinating over 30,000 people, more than the national average, if my memory serves me correctly. And can I thank my honourable friend for his leadership in Harrogate for supporting the team there to make this happen.
Video link to Clive Efford.
Thank you, Madam Deputy Speaker. The rollout of the vaccines by the NHS and the efficacy of the vaccines is to be celebrated, and I congratulate everybody involved. However, the UK has the highest mortality rate per capita of any major country. Given that the government maintains that it has consistently followed expert scientific advice, How soon does the Secretary of State think we should review that scientific advice and the decisions of the government that were based upon that advice so that we can learn the lessons of the past year as soon as possible?
Secretary of State.
Madam Deputy Speaker, we're constantly learning. Like the asymptomatic transmission of this virus, we're constantly learning about the way that it mutates, about what works effectively against it, and then we update policy according to what we learn. The nature of science is a matter of constantly learning against as new facts come to bear, and you don't wait until after a pandemic to learn. You learn all the way through it.
Video link to Ruth Edwards.
Thank you, Madam Deputy Speaker. I congratulate my right honourable friend on the pace of the vaccine rollout and welcome the good news about the sharp decline in hospital admissions and deaths amongst vaccinated groups. Does he agree with me that this provides real hope that we will be able to end social distancing along with other restrictions from the 21st of June?
Secretary of State.
Yes.
Video link Stella Creasy.
Thank you, Madam Deputy Speaker. I know that the Secretary of State shares my concern that not every community is as confident as others about taking up the vaccine, and that is why I know he will want to congratulate my local doctors and PCN networks and the local church leaders in Walthamstow who led a vaccine clinic last week in our community to help support the Black and ethnic minority residents to take up the vaccine. He will also want to congratulate my doctors on being one of the highest performers in terms of getting people to have their vaccine in the country. Will he meet with me to discuss what we can learn about this community-led approach to vaccination and how we can do more to help them in the outreach work to bridge that gap between different communities in our country so that nobody is left behind in this health challenge?
Secretary of State.
Yes, I think this is one of the Honourable Lady's campaigns that we can all get behind. She's quite right to raise the work that's being done in Walthamstow, which is very impressive. And I'll arrange a meeting between her and Minister Zahawi, the Vaccine Rollout Minister, to see what we can learn and see what we can replicate.
Sir Edward Lee.
I received an email from a lady this morning who's extremely clinically vulnerable, and she, for perfectly good medical reasons, can't receive a flu jab or a COVID jab. So she's very concerned she won't be able to leave her front door if we bring in COVID passports. So for reasons of civil liberties, will the Secretary of State make absolutely clear that we're not interested in bringing in COVID passports internally? But they are useful for foreign travel. And I say to the shadow spokesman that with the benefit of hindsight, perhaps we should have introduced a hotel quarantine system much sooner. But can the Secretary of State make clear that he will resist the travel lobby, he will absolutely upfront and be honest with people and say it's very unwise to book summer holidays now. There may be these mutants. It's better just to hold off. I think people accept the government being tough as long as the government is consistent, particularly on foreign travel.
Secretary of State.
Thank you very much. If I address each of his questions in turn, Madam Deputy Speaker. The point about certification is an important one. And whilst the decisions on certification are being currently reviewed in a review led by my right honourable friend, the Chancellor of the Duchy of Lancaster, it is clear that we will need to provide people the ability to certify whether they've had the jab, and we will need to absolutely take into consideration those who have a certified clinical reason why they can't have the jab, which does apply to a relatively small number of people, but it is an important consideration that will be taken forward as part of that work. When he comes to, I'm grateful for him expressing his views on the approach to international travel. And what I can tell him is that there is quarantine required for everybody who arrives as a passenger to this country, as well as testing on day 2 and day 8. And that means that we have a robust procedure to ensure that cases cannot be brought into this country and then spread in the community.
Video link to Ben Bradshaw.
With COVID rates in Devon now down to just 31 per 100,000, and with all the vulnerable groups due to have been vaccinated by the end of this month, what will be the justification for keeping my constituents locked down and local businesses closed through Easter and beyond because rates somewhere else happen to be higher?
Secretary of State.
We obviously had a tiered system over the autumn. One of the challenges we found was people travelling from a part of the country where rates are higher to those where they are lower. So whilst we don't rule out a localised approach to outbreaks, we are going to move down the roadmap as a nation across England.
Sir Christopher Chope.
Madam Deputy Speaker, people understand figures more than percentages. So can I ask my right honourable friend, how many people have been admitted to hospital who have already had a vaccine for at least 3 weeks in England? Because that figure will illustrate to people the risk assessment that they would like to be able to make in respect of this particular set of vaccines, in the same way as I've been told that flu vaccines are only 40% efficient. These seem to be at least 80%, which is really good news.
Secretary of State.
These I don't have the figures to hand specifically, but the MHRA, the regulator, regularly publishes what are called these adverse events. When somebody still has a problem with coronavirus having had the vaccine or a response to the vaccine, and I will ensure that whether MHRA or Public Health England, the appropriate body, publishes both in terms of number and in terms of percentage.
Video link to Hywel Williams.
Thank you, Madam Deputy Speaker. The COVID testing package reservation form for international travellers from red list countries into England requires proof of purchase of 2 COVID-19 tests before they can travel on to England and to Scotland. However, there is no reference to Wales on the form. Can the Secretary of State assure me that this is an oversight which will be remedied immediately and that international travellers from England continuing on to Wales are indeed required to comply with the testing and quarantine rules?
Secretary of State.
Yes, all international passengers are required to comply with the rules, and I will write to the honourable gentleman to set out either why the system is set out, is done in that way, or to tell him that it's been rectified if that's what's needed. It's the first time I've heard of that particular issue.
Steve Brine.
The roadmap contains a chapter on building resilience to future pandemics, which I think we have to be honest and say are not going to leave us alone for another 100 years. So with respect to the global network of zoonotic research hubs, which the Prime Minister wisely set out in his 5-point plan of the UN last September, can we make sure these build on the work of experienced virus hunters already out there, organisations like the Global Health Network, who have years of experience searching for unseen viruses that leap from animals to humans?
Secretary of State.
Yes, the proposed work, as set out by the Prime Minister at the UN General Assembly, which we're working on as president with our presidency of the G7, aims precisely to build on and strengthen the existing work that has been underway, but clearly we need to ensure that all of the future risks, whether they're from zoonotic diseases or due to environmental changes that lead to risks to human health. All these things need to be taken into account, and we need to have an early warning system that is as effective as possible.
Video link to Jamie Stone.
Thank you, Madam Deputy Speaker. This very afternoon, I am going to get a JAG. I point out that the JAG is a Scottish term for a vaccination, not a posh car. Getting the maximum number of people in the Highlands vaccinated as fast as possible is crucial for the reopening of businesses in my constituency, including those in hospitality and tourism. Can I ask the Secretary of State to please give the maximum encouragement to the Scottish Government to make sure that this happens?
Secretary of State.
Madam Deputy Speaker, the vaccination programme is a successful UK-wide programme. We work very closely with the Scottish NHS and indeed the Scottish Government to make sure that right across all of these islands we have the vaccination available fairly, according to clinical need, as fast as we possibly can. And we can deliver this because we are one United Kingdom, with the buying power and the scientific capability that comes from being one United Kingdom, all working together. This simply wouldn't be possible if there were the separation that some propose. And I will do everything I possibly can to ensure that businesses across Scotland, that residents in Scotland, get the protection from the jab that they deserve at an equal pace to everywhere else in this country. It is an absolutely crucial part of getting all of us on the road to recovery.
Sir Desmond Swain.
In order that we get and keep herd immunity, is my right honourable friend planning any hard-hitting public information campaigns to ensure that younger adults take up the vaccine with the level of enthusiasm that my relatively elderly constituents have done?
Secretary of State.
Yes, we are absolutely planning to instil as much enthusiasm as we can muster amongst younger people, as we've seen amongst older people. And the message to anybody who is at the younger end of the age spectrum is that getting a jab helps to set us all free and back on the road to recovery. It helps protect you, including from long COVID, which can be a debilitating condition, and it helps protect all of us. It is the right thing to do.
Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank the Secretary of State for an incredible, record-breaking vaccine rollout? We're all incredibly impressed. The wonderful results showing that even one dose of vaccination reduces the chance of hospital admissions by 80%. Would or could the Secretary of State outline the rationale for not looking at having all frontline services vaccinated, rather, and as an example, seeing a 61-year-old writer who is able to work from home receiving a vaccination before a 59-year-old shop worker who is face-to-face with hundreds of different people each day? And should the Secretary of State and Government not consider these thousands of frontline workers who have made the continuance of life possible during these very difficult times? Thank you.
Well, we did consider this question and asked our clinical advisors, the JCVI, to look into this question, and they found that notwithstanding the different risks that different occupations face, the overriding determinant of risk is age, and therefore we're proceeding on the basis of that advice across the UK.
Video link to Jason McCartney.
Thank you, Madam Deputy Speaker. Over 40% of the adult population of my Colne Valley constituency have now received a vaccination, a truly magnificent effort. But across Kirklees, though, there has been an uptick in COVID cases last week. What message can the Health Secretary send to my constituents so that we can stay on track with the roadmap out of lockdown?
Secretary of State.
Thank you very much, Madam Deputy Speaker. I'm very grateful to my honourable friend for asking this question, because we have seen in a minority of areas a small increase in the number of cases, and it does include Kirklees. And we've seen this in around just under 1 in 5 local authority areas. And my message to everybody in Kirklees is that this isn't over yet. We have a roadmap out, but it isn't a roadmap for government alone. It's a roadmap for all of us to walk down together. And that means following the rules, and that means for now, stay at home. But by doing that, we can all then move on the dates that are set out. And instead of not before dates, they will become the dates that we can make the next step. But it is on all of us, and so I'd urge everybody to continue. I know it's been a difficult winter, and I know the sun is starting to shine a bit brighter, but we must all stick at this. We can see the way out, and I hope that we can get there together.
Final question is a video link to Mari Rimmer.
Madam Deputy Speaker, over 3,000 clinically vulnerable people in cohort 6 are going to have their vaccinations cancelled in St Helens at the end of this week. This is unless the required supplies are delivered by Thursday lunchtime. The vaccine site is serving 4 primary care networks, yet the national supply team is only recognising and supplying 1 network. The mutual aid gathered to cover this shortfall in the past is no longer available. Will the Secretary of State please urgently intervene to address this misunderstanding so that no vaccinations are cancelled?
Secretary of State.
I'll absolutely ensure that the Minister for Vaccine Rollout gets in contact directly with the Honourable Lady. This is a massive effort, and so there may be logistical challenges. We'll look and understand what the situation is in St Helens. As I have some family in St Helens, I'm pretty keen to make sure this gets sorted ASAP, Madam Deputy Speaker. But it just shows that it isn't easy to do this, and the team are working incredibly hard to resolve issues like the one that the Honourable Lady rightly raised all the time to make sure that this can go as smoothly as possible.
I thank the Secretary of State for his statement and suspend the House for 3 minutes to make necessary arrangements for the next business.